Hi, everybody. This is Dr. Seda. I help patients with pain with ozone therapy, and we have here a patient that has a great story, and he wants to share with us. And finally, we have the opportunity. Hey, Paul, tell us a little bit about how long we've seen you, how you were before, and just give us a little bit of information.
Absolutely. Appreciate that, Dr. Seda. My name is Paul. I'm just happy to be able to share this information or testimonial with you. So I've been seeing Dr. Seda at least about a year, and I've been here about 4 different times within that year for different areas of the body, okay? And the first time I came in, I came in with a cane. I was walking nice and slow. And I was just having pain in a lot of different areas, but the main area was my back. And so, they checked my back. They checked the areas that I felt I was having pain in, and then they actually pushed some pressure points and showed me that there was some pain areas that were causing the pain. And so we got the first shots and everything, and he just kind of talked me through it and told me the whole process, how it worked. And then so when I got down off of the table, I was just like amazed, because not only did it clear up the pain that was most recent in my back, but it cleared up pain that I had been having since like 2011. It was really amazing. So it had been there for a long time. And it was like, I told him, I said, it feels like a miracle. I don't have any pain back there. And I had been in the hospital a number of times for the pain and taking a variety of medications. And so then after that, when that pain was cleared up, then I had some pain in my shoulder. I don't know if it was bursitis or arthritis, whatever it was, but they worked on that to get that pain cleared up. And then some pain down in my knees, all the way down to my ankle. So I've had some injuries in my knees. And so I'm really happy about that. So I came in today. This is the second time that I've had something done for my knees, but it's been like 6 months. Yeah. So one application, and it lasted a whole 6 months for me. Wow. Which we didn't think was going to last that long, but really it has. And it's a natural therapy. We would love it if it was just permanent, but I love it even though I could get 6 months of no pain. Oh boy, I tell you, anybody that has had pain, either continuous pain or sporadic pain that comes up, and it's at a certain level, you will appreciate this therapy, and that it's a natural therapy. So I'm so happy about that. And when I walked out, I was carrying my cane on my shoulder that first time, literally carrying it on my shoulder. And I had some times when I was laying on my bed, I was just done. I was done. I mean, any movements, I was trying to find a good spot. The fetal position was the spot. And so my wife had to really take care of me, and I was trying all kinds of creams and different things, and I even tried where you get your back straightened out and all that kind of stuff. That helped somewhat, but this just got rid of the pain altogether. And then one time I came in, I was like, I had this sciatic nerve problem, and they were giving me all kinds of medications. I was like, oh my God. I said, when I can just get a chance to move enough, I'm going in there. And came in here, and it took care of it. It was cleared up. We did it, and that took a couple of days, but it went in and got the job done. So I can certainly give you a kudos.
There you go.
Not only on your personality, but on your process and the medical process. Awesome. And the staff here is great and everything. So, and I'm a military vet, been to Iraq, Afghanistan, Kuwait. I've been in a lot of rough spots, I'm thankful to have all of my fingers and toes, but, when you get you get jolted, you have bombs going off around you, you falling on the ground, there are injuries that are more so internal as well as could be external, but there are some, and they might not come right then when you got all the adrenaline going through, but later on, they show up. So it's good to have this type of a process which is natural, because vitamin M, I guess.
Yeah, Motrin 800.
Motrin, vitamin M. I use so much Motrin, it was like, hey, you gotta watch out. You don't want to mess up your stomach and liver.
That's a VA for you right there.
Yeah, so, I mean, it helped to a point, but it never completely gets the pain away. But this it just gets that pain out of there. So I'm happy and just thankful.
So you're not using the medications like before, like all those meds that you had before.
No, I was using Tylenol with acetaminophen. I was using some other stuff that was stronger than.
Yeah.
I mean, I had at one time I was using morphine, and I think dopamine. And a couple of times they had to give me a couple medicines all at once to try to deal with the pain. And I mean, there was some pain that was in my muscles. It was just like nothing was really working. I'm talking about the doctor would say, "What's your pain level?" Between 1 and 10. And literally, I told the doctor 11. Yeah. I mean, because I'm sitting there, grown man, in my military uniform, tears coming down my eyes, and hospitalized for 2 or 3 days just because of pain. It was crazy. I was like, oh. And I mean, we really didn't know what was causing that pain. It was like, then my body was taking, I was losing potassium at a high rate.
Okay.
So they would give me a lot of potassium, but, even with all that and the medication, they took it from a 10 maybe down to a 4.
Okay.
And I was happy with that.
Right.
Literally, but, and then.
But you were still with a cane though.
Yes.
So you had less pain, but you still couldn't. Your mobility wasn't there.
Didn't have the mobility, and that's a good thing to bring up. Didn't have the mobility. I was like, man, I was like talking to my doctor. I was like, hey, I'm going from 2 miles down to 1 mile. I'm like, I'm trying, but I'm losing strength. And so, but then after this, I was able to get back up to my 2 miles, 2 miles walking because my knees are hurt pretty bad. But so now after this, now I'll be able to go back out and start walking my 2 miles again.
There you go.
I'm gonna gradually get back up to it. Because when I get down to about 1 mile and then I can't go, I'm like, okay, you got to go back and see the doctor again. And so I was at that point. And so I didn't know when I could get an appointment. So this morning I was like, I got to take me a Motrin. And I said, I'm calling the doctor right now. So I had no idea I was going to get in here today. Otherwise, I would have just left the Motrin alone. But I'm here. I'm thankful. And I can feel the difference like in my legs even right now. And
we'll have you walk in a minute. I remember the first time that you came, we took a picture. So we have it and you're there standing with your cane in your hand.
Right.
That's a pretty cool picture. I think that we're going to incorporate it. We'll find it. We'll put it in the video. When we kind of like edit it later on, and then so you haven't had to the last time that you had to use the cane was on that day that you visited us,
right? That
was it. The last day.
That was.
So you would have probably left it hanging for
as
a souvenir.
It's like, man. And it's like in my car on the left hand side, but that's where it's been since that last time. So I can just take it out and put it. So I can use it as a weapon now because I haven't had to use that cane at all anymore. I'm just so happy about it. I look down at it and I just push it down further down the floor. I don't need you.
It's like a good reminder of where you were. Subscribe and please the bell. Thank you. You've come a long way. And actually, Yolanda was telling me you were confiding this morning that you were chopping wood or something.
I was out literally. I had a saw, but I was out literally. I had it's called a maul.
Okay.
A big piece of metal, and then you have this it's a circular hammer, which is. I can't think of the name of it. But I actually was out and I split some wood, and I didn't only split a small piece of wood. I split a big log, There
you go.
And when I first started, I was like, I don't know if I should do this.
Right.
But I had done my stretches and everything. And so I broke off the first little piece and I said, oh, that worked out all right. So I ended up splitting that whole piece of wood.
There you go.
And my wife was like, you did what? She was scared. I was like, no. I said, I was listening to my body.
Yeah.
And I was able to do it. And I felt so happy.
That's so awesome.
Because before I wouldn't been able to, it's one swing and I'd have been like, oh.
Yes.
So it was amazing, really amazing. And so.
I remember your wife when you came the first time, it was like she was concerned and she was telling us asking, am I gonna get my husband back? She really wanted you to have back the old self, happy, jolly, going, doing. But because when you're in pain, your personality just gets dull. You cannot, because we have a lot of fun when you come because we're just joking and you're very, very lively like that. But the first time, when you're in pain, it's just not that personality doesn't come out because you're just almost just suffering through it.
Right.
But it's been a pleasure to be able to help you. And you know, we've grown since when you came. Now we have this reclinable chair that we have, so that this is the waiting area. That's how we roll now.
Yes,
you know?
yes.
Getting better. Got a few more chairs there. So, you know, it's been a great journey, and thank you for sharing this. I know that we wanted to record it, but we kind of never could, and finally we had the opportunity. So, so thank you, Paul. Anything that you would like to add to somebody that is out there, maybe a veteran or anybody out there that their doctor tells them, hey, there's not much for you?
Right. Hey, no, I would tell you, come and try it. You know, you have to get the shots. You know, so if you're afraid of needles, they're gonna give you a nice cold spray. You might feel a little pinch, but you may feel a little bit of discomfort for maybe 45 seconds. You know, but you know the oxygen has to go in there. I should say the
ozone,
liquefied oxygen has to go in there. So it's just finding its place in your body, and then afterwards, you know, I just take time and I got this little ball and I just roll it around, and just to try to spread it as far as I can get it to go, or I do a massage or something like that. But I do it, or my wife does it. You know, they don't mind giving me the massage because they know he's gonna be a happy camper after this. He won't be so temperamental. And you know, you won't have to look at him and say, "Hey, what's your pain level today?" I mean, look, my wife would literally say, "What's your pain level today?" And when I told her I've got a symphony of pain, she said, "I never heard of that. What does that mean?" I said, "I'm hurting right here. My back is hurting. My knees are hurting. My ankles are hurting." It's like, let me just lay down.
Yeah.
You know, so when she could say, "What's your pain level?" I'm at a 7. I'm at a 5. When I say, "Well, I'm under a 5," she's like, "Okay, he's doing good." But then when I come in, I was like, "Girl, I'm at a 2 or 1 or what? Do I have any pain?" You know, it's like, it's beautiful. I mean, it's really, really beautiful. So she was happy. I said, "Well, Vic, you know, they said they can see me today, but I don't get paid till tomorrow." She's like, "Oh no, I'll pay for it." Just going on in there today. So I said, "I'll pay you back tomorrow." So you know, hey, you know, you may have a veteran's disability. It's not going to change that because it's not a permanent take away everything. But it is, if it's 6 months of no pain, that is a blessing, you know. So I had checked with VA, and it was like, no, you know, it's a natural remedy. You know, it's not like you had a miracle, you cured, but you know, completely cured. But if it gives you a healing feeling, then that's a blessing, you know. And if you can do, I'm serious, you know. I was like, I didn't know how long it was gonna last first time I said, but if I can have this for like a month, I don't care. I'll be back every month. But it lasted much longer. So hey, it's worth it, you know, to have that pain to be released, and where you're in a tolerable state, or where you know it may be all gone for like 2 to 3 months. That's a good thing, and you know it gives you better quality of life, better mobility, better your temperament and everything. It'll calm you down, and you know, I mean, sometimes I would just be in the closet in a dark room, you know, or just laying in my bed in one spot, and, you know, what kind of life is that? So I just encourage all veterans, hey, come over here and to Dr. Seda, get this pain management, you know, thing, give it a chance, and you will be very, very pleasantly surprised, and it'll enhance your quality of life, you know. So no joke. So you just come on out here and try it.
Thank you.
Right.
Well, that was a great recommendation. Thank you, Paul, for your story. And then we'll put that picture so later on you guys can see it. And then there you go, guys. If you have anybody that is in pain, you know, that has been trying other things and have not found a solution, it doesn't matter if they were told that they need surgery, they have a cane or a walker or a wheelchair. I mean, it doesn't matter. It is more about treating the source of what was going on. And then once those knots go away, then the pain goes away. You can regain mobility. Yeah. So can you stand for us? I mean, can you walk for us a little bit?
I can walk for you. There we go.
Because before he came with a cane. Now let's see now. And he got just today, so.
I was walking a little slow, but I came in this morning.
There you go. Okay.
But I'm good now.
So let's see if Troy's gonna come, and you can.
All right. I'll walk on down here.
Just go ahead and walk. There
and I can
go.
tell too. And you know what? As a matter of fact, another thing I can say is, I was going to church, you know.
Yeah.
And I was. My wife said, "You gonna wear those tennis shoes?" I was like, "Yeah." I said, "They give me better stability." She's like, I was like, because I knew it was getting about time for me to come back over here. But for the last couple of weeks, I was wearing tennis shoes with a suit. But now I can, I can just go to church and, just wear my regular shoes, which
There you
is
go.
really a blessing. So
That's awesome.
that's good, yeah, because before I was having pain right there and everything. So, yeah.
There you have it.
So, see?
There you go.
My wife tells me don't push it. I told her, but I did when I was up there last time. I was up there skipping.
There you go.
Skipping, she said, you skip it. I was like, yeah.
skipping. I
So
love
it's
that,
a
man.
blessing. It's a blessing.
Oh,
really,
it's a pleasure.
So, yeah. So,
Well, there you guys.
I'm thankful.
There you have it. Thank you, man.
You're welcome,
Yeah.
doctor.